Hello. Hello, everybody. Welcome very much today to our webinar. We're very thrilled to have everyone on board. We've got a very exciting panel lined up, and I'm hoping we're going to have a very good discussion about some religious guidelines for the COVID crisis and some practical steps that communities of faith, including Muslim communities in particular, can take to try and keep safe during these difficult times. My name is Simona French. I'm the head of media and external relations at Islamic Relief, based in the UK, where I'm working a lot on the coronavirus crisis and, in fact, a lot of other things across the world. So speakers we have today with us are Atala Fitzgibbon. He's been working in the NGO sector for many decades, has been with Islamic Relief for over 20. He's a real institution, having served as our head of programs, our head of advocacy, and now as our faith advisor. So he has been a key driving force behind the guidelines. We also will be joined very shortly by Sheikh Fahim from the British Board of Scholars and Imams. Unfortunately, he's running a tiny little bit late, so we'll introduce him when he is able to join us. We've also got Dr. Jaffar Hussain, who is joining us from the WHO based in Cairo. He is their Chief of Cabinet at the WHO there at the Middle East region. He's got more than 25 years experience working in various UN agencies such as UNHCR and lastly the WHO, and he is a public health specialist by training. And then also we are very thrilled to have our programmatic colleagues with us as well. We've got Noor Ismail, who is our head of West Africa region, working across the Sahel, as well Mali, Niger, and she's been working on that for several years and comes with us from the Ebola response as well, where she helped to coordinate that for Islamic Relief. We've also got Saba Mahmood, who is our humanitarian coordinator. Saba has been with us for a number of years, working on some of the biggest crises of our time, such as the Rohingya refugee crisis, the conflict in South Sudan, and more recently, natural disasters in conflict IDI and conflict IDI. So, and she's now coordinating our COVID response. So to not bore you too much, I will hand over to speakers very quickly. A couple of just housekeeping issues. We're very thrilled that so many people from different languages can be able to join us. So there is a CC button on your screen. It should be on your bottom left side. That should be turned on if you would like to have subtitles come up in many languages. You click the CC button, it should help to select the language of your choice. We also have a question and answer session. We will be kicking that off probably about halfway through to give you enough time to ask your questions, and then there'll be about 20 minutes at the end for us to have a hopefully very fruitful discussion on the issues. Again, the question and answer session tab should be on the bottom left next to the CC. Do write there, and the moderators can try and get back to you or publish if it's something worthwhile. So I will publicly kick off once that tab is open for everyone, but we'll let the speakers start off first to make sure you're getting a good idea of everything that's going on. So with that, I'd like to hand over to my colleague Atala Fitzgibbon, who I said has been a really key driving force behind these guidelines. Welcome, Atala.
Thank you. Good afternoon. Thank you, Simona, and welcome everybody. And I'm pleased there's so much interest in this subject. So very briefly, I'm going to talk about the background to the guidelines and what brought them about and what they're supposed to do. So it's been quite high profile that collective worship and other religious practice has been a factor in the spread of coronavirus early on, or was allegedly a factor, and almost certainly was, and probably continues to be. Islamic Relief learnt 3 or 4 years ago during the Ebola crisis that religious practice was a key factor in reducing transmission of that very virulent disease, and we had, with other faith-based organisations, done research around this in Sierra Leone, looking at the role of faith actors, and we had sensitized WHO to the fact that certain religious practices were passing on the disease. So we were quite quick off the mark in terms of recognizing that we needed to move fairly quickly on this. Well, not quickly enough, really, but the reality is that Islam particularly is a very tactile religion. It's a communal religion. Muslims often meet up to 5 times a day. They pray together, literally touching, shoulder to shoulder. It's a broader social system which often involves visiting each other, communal events, social events, etc. So what was critical in terms of our learning from previous times is that we integrated faith literate advice and faith sensitive advice in the messaging that we're doing to communities, and we're focusing on 3 areas, principally messaging to communities, including faith through faith leaders, health and hygiene support, and livelihoods, or cash and food transfers. So the religious guidance in Islam is based around Islamic teaching and law around prayer and a whole range of other things. However, jurisprudence is in Islamic teaching is set up on a system of ethics, which enables scholars to adjust practice based on a set of principles, legal principles, and this enables the flexibility of the religion to be flexible in to such events and to changing circumstances. So scholars were quite quick in the Muslim world to use those principles of jurisprudence to suspend collective worship and the minor pilgrimage to Mecca and all of these things. So there was people were quite quick off the mark in many countries in understanding the importance of this. However, that wasn't universal, and there continues to be difference, and it was important that we provide our staff, first of all, the basic guidance on where they could start conversations and discourse with local communities on. So the guidelines is based around the advice and guidance from scholars around the suspension of collective worship and a range of other issues. And it's based around Islamic principles, which is principled on the first principle, which is the protection of life. So the protection of life enables us to suspend normal practice. The third point I want to make before I finish is around the important emphasis in the guidelines on burial practice, because this was something particularly we found during the Ebola crisis, that the Islamic practice of washing the body prior to burial it was a major factor in passing on the virus in the case of Ebola. Now, with COVID-19, the WHO's guidance is that bodily fluids, the actual body can't transmit it, but the bodily fluids can, so saliva, bodily waste, etc. And during the traditional washing of the body, those bodily fluids are often excreted from the body or pushed out and cleaned. So there was a high risk of contagion from this, and in the UK, where this has become a major issue, because in much of the Muslim world, there hasn't been large numbers of deaths, fortunately, so far. But should that be the case, we will have to mobilise faith communities around that. And in the UK, it's involved training volunteers who wash bodies, both men and women, and undertakers, on doing that. Now, in the Muslim world, normally the body washing is done in the home by the family, so it requires really quite a high level of communication of that, and we sensitized our teams around the world to that. There's also guidance come out, further guidance on Ramadan, which we've been circulating, and which is accessible both from the WHO and BBSI, the British Board of Scholars and Imams, should people be interested. But the Ramadan will also obviously need to require Muslims to act very differently in terms of suspending the normal nighttime and evening gatherings to break the fast and to pray together and to generally socialize. So I'll finish there, Simona. My time's up, and pass on to the next speaker.
Thank you very much, Atala. Some really interesting information, and I definitely have some few questions for you that will come towards the end. Dr. Jaffar, I'd love to hear a little bit more about the WHO's perspective on this, and indeed the crisis in general, because you found yourself very much at the heart of it all.
Thank you, Simona. You were your voice was breaking up. So, are you kindly inviting me to be the next speaker?
Yes. I'm afraid
Okay.
Sheikh Fahim is a little bit delayed. So thank you for stepping in. Yes, you're live now, Dr. Fahim. Dr. Jaffar, sorry.
Thank you. Okay. Thank you. Do you hear me?
Yes, we can hear you. Yeah.
Okay. So thank you for this great opportunity where faith and science are interfacing with each other for the betterment of the people, particularly people who are in the coming Ramadan or Muslims in the coming Ramadan will be practicing measures which, as the previous speaker very rightly identified, would affect the epidemiology of the disease, which in this case is COVID-19. Now, rightly pointed out about the measures taken or recommended during the Ebola crisis, and this one is particularly of a very unique nature. Because it's much more widespread than Ebola. It has affected every country in the world, and it has very grave social, economic, and societal impact in addition to the public health impact it is causing, which is evident in the form of morbidity and mortality which we are facing. Now, this is also a unique disease or a pandemic where not only religious but cultural and societal practices are greatly on the spotlight. And when I say greatly on the spotlight, because specifically in the region where I'm serving, but obviously beyond in not only Muslim societies but also similar cultures in non-Muslim societies where there is a tradition to get together in one home, have an evening meal, or pray together, or have other events together, which we as WHO recommend otherwise to have a social distancing. Now that social distancing is applicable to religious rituals, as well as cultural gatherings, as well as societal and social gatherings equally. And that's why the Ramadan month, holy month of Ramadan coming, we in WHO are quite concerned because there will be larger gatherings, presumably, during Taraweeh, for example, or Jummah prayers, and also the tendency that in Ramadan people pray more and they turn up more and more into mosques to have their prayers offered there, where the WHO recommended distancing, which is 3 feet or 1 meter, it's very difficult to maintain. So we have been working with some key scholars at the regional level. I just need to inform you, we have a platform which we established actually for polio in the beginning. That's called Islamic Advisory Group. And that has the membership from the Office of the Organization of Islamic Conference, OIC, Islamic Development Bank, the Regional Islamic Fiqh, and the Grand Mosque of Al-Azhar Al-Sharif. We then expanded this to, because we were facing problems in polio vaccination in Pakistan and Afghanistan. So we were working very closely with this group to influence the local ulama or religious scholars so that they can be of value, engaging the communities and motivating the communities and parents to bring their children for vaccination. We now are using that platform very effectively, and in close consultation, the Ramadan guidelines which we issued globally on 15th of April actually is in very close consultation with, and I don't need to go to the guidelines, they are available on the web page, or I can share with all of you, where again we are recommending social distancing. We are advising that those who have comorbidities or those who are of an age group which is more vulnerable, for example 60 and above, should primarily avoid congregational prayers and can practice those at home. Also avoiding, there is a practice in Muslim societies to have collective iftars, and for that we are recommending that charity iftars, which is a very normal practice not only in the region but beyond. It's better to have boxed iftars and distribute them to the people who need them, and some of the countries are actually following that practice. We also have the burial guidelines. My colleague referred to it rightly, issued so that people are can use those guidelines while burying their loved ones who died of COVID-19 particularly. And then finally, we also in this religious these guidelines, not religious, Ramadan guideline, there were a lot of questions coming to WHO on a couple of various things, but most importantly, fasting. Should a normal individual fast? Would that increase the vulnerability of individuals to contract COVID-19? Or those who are mild cases of COVID-19, should they fast or not? So we recommend that fasting has no direct relationship with COVID-19, and fasting should be considered as, according to the religious practices, as considered in any other disease. So if the disease is contributing to ill health, then obviously, based on the advice of the local physician, fasting can be avoided. But if there is no risk of any health condition exacerbated, then there is no, because there are a lot of myths going around. And then lastly, the issue of this. Now here the science and the religious injunctions are very clear, but obviously in our culture, religion mostly not is is guided by purely religious injunctions, Quran or Hadith. There are so many cultural attributes around it, and people put those together. So this a lot of scholars came to us and said, listen, your science says that we should not go to mosque, but this is a waba. This is a curse from Allah. And if you don't go and pray in groups and seeking forgiveness, this waba will not go. So our answer is that we cannot, as WHO, advise you on something which we don't have the mandate, or we don't have the, but we have group of religious scholars who can advise you. We are engaged, but we are just recommending the social distancing component, which has proven to be the key. And it's not only in prayers or other religious congregation. Why we recommended of closing of schools, for example, universities and other marketplaces and things like that, where we don't want people to come together and be the source of transmission. So I'll end up here, and if there are any questions, I will be glad to respond. Thank you so much, Simona. Over to you.
Thank you so much, Jaffar. So we're going to open up the Q&A. As I said previously, you'll be able to see the button on the bottom left side. Please do leave your name and organization if appropriate to do so, or help us filter through the questions and make sure that as many relevant things get asked as possible. With this, I'd like to pass over to Saba Mahmood, who I said is a key player in our global coronavirus response. It is a global response that started several weeks ago, aiming to get 10 million in emergency funding to 20 sort of priority countries, those that have been hardest hit in the West, obviously, where we have seen the biggest death toll, but also many across the global South, such as Afghanistan, which is very close to Iran and saw a kind of a peak in numbers, other places as well, like Syria, which is incredibly vulnerable due to conflict. But Saba will give us an overview of our response, and then we will pass over to Sister Noor, who will talk about the specific West Africa context. So thank you both very much. And I'll let you just flow from Saba to Noor. I think that will be easy to do.
Great, thank you, Simona, for that. So as Simona said, I'm going to provide a brief summary of Islamic Relief's global response to this crisis. We're going to try and get some photos up from our various responses on the screen in the background while I'm talking, so hopefully you'll be able to see those. As I'm sure you're all aware, the level of infection and death caused by COVID-19 is at differing stages in regions across the world. For our 34 field offices across East and West Africa, Asia and the Middle East, this means that there are varying levels of preparedness and response operations being undertaken. So as Simona was saying, Islamic Relief has launched a global COVID response. We're aiming to get $10 million worth of aid to at-risk communities in at least 20 countries in the coming weeks. So what I want to do is just quickly explain our programmatic approach in terms of this response, and also provide you with some examples of our responses in specific countries. So in terms of our programmatic approach, we've been focusing on 3 areas. The first of the 3 areas that we're focusing on is ensuring that communities are engaged for the promotion of good practices and information relating to COVID. This includes activities such as the distribution of hygiene kits, consisting of items like soap and hand sanitizers, gloves, masks, and those kind of things that you can imagine. This approach also includes the promotion of health and hygiene practices throughout communities, so things like hand washing, and also working with faith leaders and actors to develop and disseminate messaging on safe practices. So in terms of examples, our responses in Mali and Niger primarily align with this community engagement approach. In those two countries, we're focusing on reaching vulnerable communities through providing water, sanitation and hygiene support, training up key focal points within communities and camps, and undertaking awareness and sensitization activities. The teams in Mali and Niger will also be supporting existing health facilities and workers, but a key element of these projects is the training of faith leaders and the dissemination of faith-based messaging on COVID. And that really is vital, as Atala and Dr. Jaffar were explaining. So my colleague Noor, who's the head of West Africa region, she's going to go into more detail about West Africa responses in the next section. So I'll leave it there in terms of examples under this approach. The second programmatic focus area for Islamic Relief is supporting and strengthening existing health systems. So we'll do this by supporting local, provincial and national mechanisms in response to the COVID outbreak through working closely with organizations like disaster management and public health authorities in countries, and providing personal protective equipment. We'll also aim to strengthen health facilities in areas where we're already having health and nutrition projects and are supporting health centres. So examples of responses being undertaken by Islamic Relief that align with this approach in particular are in Afghanistan, Syria and Yemen. So in Afghanistan, our response is in Herat, like Simona was saying, which is close to the Iran border. And that area has seen cases of cross-border movement and transmission. Our response there consists of working closely with the Department of Public Health to support the public health infrastructure with personal protective equipment. In Syria, where obviously the needs are ongoing and vast due to the ongoing conflict, we're primarily operating, we operate in northwestern Syria, specifically in Idlib and Aleppo. So we've started our responses there with distributions of medical items to health facilities, and the teams will also be working to support communities by undertaking awareness activities and distributing hygiene kits and food parcels for the most vulnerable internally displaced people. In Yemen, again, as I'm sure you're aware, because of the ongoing conflict, the healthcare system there has almost completely collapsed, and only 51% of health facilities are still functioning. There's also a severe shortage of medicines, of equipment and of healthcare staff across the country. So in Yemen, our team has begun to adapt its existing programs by undertaking awareness and sensitization activities in all existing distribution sites. So far, we've reached over 600 people in quarantine centres through the distribution of meals and hygiene kits, and our team there is undertaking interventions in facilities and isolation centres by providing supplies, equipment, training and monthly incentives to healthcare workers. Finally, the third programmatic area of focus for us is ensuring that the longer term and the secondary impacts of COVID are factored in from the outset. We'll do this by ensuring immediate support is provided to the most vulnerable families through emergency food security interventions and cash transfers wherever we can do that. So we'll specifically be targeting vulnerable groups that we're already working with, like children and women-headed households under our orphans and child sponsorship program. We're going to have, and we have, an adaptable approach where Islamic Relief will continue to engage in its projects like in the sectors of education and livelihoods, but we're very much recognizing that the effects of this COVID crisis are going to continue and will be felt for years to come. We'll also be advocating for and supporting social protection mechanisms to adapt to the needs of affected people. So in terms of examples, our responses aligned with this area are countries such as Albania, Kosovo, Bosnia, and Jordan, where we're focusing on providing cash transfers to vulnerable families that have been really significantly impacted by the economic impacts of the COVID crisis, especially during lockdown situations in their countries. So that completes the summary of where we're at currently and the approach that we're undertaking. So hope that was helpful, and I will now pass back to Simona, or go straight to Noor, as you were saying, maybe.
Yes, let's go straight on to Sister Noor. Sister Noor, can you unmute yourself? There we go. I think, Sister Noor, you're live now, so yes, there you go.
In the context of Sahel, where people are suffering acute food insecurity affected by climate change and conflict, the impact of the COVID-19 is far-reaching. So in Niger and Mali and Chad, the government has imposed a lockdown, but this has challenges in terms of the communities observing the lockdown because of the means are being affected. The communities are quite reluctant to observe the social distancing and also to go out during the restrictive hours. This is where the crucial role of Imams are being comes to play. The government in the respective countries have reached out to the Imams to raise awareness on the preventative measures that is required, because in cases of COVID in those countries are not as high as, for example, in Kenya or in Europe. And so the population are still not able to comprehend the severity of the spread of the COVID-19. So the Imams now are actively reaching out to the communities through preaching through the radio stations, and in some cases also through television awareness sessions. But however, although the Imams have a role to play, they are also adversely impacted by the lockdown. So in most cases, these Imams are dependent on the income from their role in the mosque and also their preaching to the communities. With the lockdown, all levels of societies have been impacted economically. So the role of Islamic Relief in its program design is to look at how we can support the communities in addressing their food security, and at the same time in raising the awareness on the preventative measures. And there are challenges where we have to consider the fluid movement of the population, especially when we are looking at the IDPs and some of the displaced in the urban setting too. So Islamic Relief in Mali and Niger, we are adapting our program to take into account the spread of the virus through the various preventative measures. We are now currently launching the Ramadan program. So we have adapted different modality in order to make sure that we are in compliance with the government restriction on the social distancing, but at the same time to ensure that the communities have access to the food distribution during the Ramadan. The traders' availability of food is also affected because the borders are closed for all those countries, and there is quite a high volume of traffic of informal trading between the borders. And as a result of the lockdown, this has curtailed the source of income for the communities. Therefore, the role of the Imams in assuring the communities, in giving them the strength to observe the directives from the health ministries and the government is crucial at this stage, so that there is no escalation of the spread of the virus. That would be all from me for now.
Great. Thank you so much. And thank you for everyone that's been sending in the questions. We've got quite a few already. I would invite you to please do send them through. We've got about another 20 minutes to go. Unfortunately, Sheikh Fahim has had some technical difficulties and he hasn't been able to log in yet. He is online though, so we have requested that he send through a couple of words of wisdom that we can share with you. If you do have any specific questions for him as well, please do email us and we'll make sure that he responds to you directly as best as he can. So apologies for that, and I do hope that we'll be able to have him join us before the end of the call. So the first question I wanted to ask personally, sorry, to jump in, is Atullah. And one thing that I, reading the guidelines, felt was really, really interesting, actually, and very relevant to this modern society where we live with, so flooded by fake news and whatnot, was the spiritual need for the truth, basically, and not spreading misinformation at times like this. And I was just wondering if you could elaborate a little bit more about how they came to pass and why you think that is especially relevant at the moment.
Thank you, Simona. Yeah, I mean, clearly, this has been highlighted as a major problem, including within the Muslim community. And we've had feedback from offices and colleagues in countries to say that there is in a situation like this, sort of conspiracy theories and alternative discourse starts quite quickly. It's also possible to retweet or spread social media, irresponsible social media messages. And in the context of many of the countries where we work, where there may be communities in competition, in other words, there may be Muslim, Christian, Buddhist communities, all in competition for limited healthcare and resources, and all extremely suspicious of politicians. Such things can lead quite quickly to things descending into violence and lawlessness and harm, as well as ridiculous things like runs on toilet paper and stuff like this, which is well documented in this country. So we wanted to reiterate the importance of the prophetic messaging around not repeating rumours or gossip or anything like that, that we will be responsible for what we write and what we spread. And that's extremely important, and it's extremely important to check any of the sources you're using, and even if it may be true, wondering, thinking about, well, how helpful would this be to be known by the wider group? There's all these levels of responsibility that are incumbent upon Muslims in particular. So we've included that. Thank you.
Great. Not to overburden on Atullah, but the next question is for you as well, and then we'll switch over to Dr. Jaffar. So we've got a question from Jorgen in Danish Church Aid, and he says, great, thank you, Atullah. Could you give us a short idea of the information channels you intend to use to disseminate the guidance, for instance, on burial? The guidance document is long, and to reach family members in the community level seems to be quite a job. So how do you plan to do that? And obviously, Dr. Jaffar, I know the WHO is kind of working on this as well, so I think maybe you can help answer this question as well.
Thank you, Jorgen, and welcome. Yes, so they are longer than I would like, these guidelines, and we had to err on the side of caution in terms of not making them so brief that they're not actually useful. So they are really probably more helpful to people, professionals within the sector, and to faith leaders and people like that who can read the detail and understand the detail. we have been engaging with some of our staff at field level around communicating them, and some of our offices in Africa, as Sanur mentioned, there is actively a process of including faith leaders in things like radio messaging, which is probably the most widespread form of mass communication in rural areas, remote areas. And obviously there is this challenge around dissemination of them, and many of our staff are also facing lockdowns, and there's been an inconsistent response by authorities to enabling humanitarian actors to become able to move and act, and that's problematic. And we've taken that up with people like UNHCR and others who are lobbying on our behalf. However, what we have impressed upon our staff is the need to include mobilization around, particularly on burial areas, within health teams and within health messaging. And this wasn't, I don't think this was intuitive. I think many would not have realized the importance of this, and still maybe don't. And the reason is because it tends to be when a problem occurs that we suddenly realize that it's a problem. And we've got to learn from the Ebola crisis that we've got to be preemptive around action on burials, because it requires quite detailed training. Like in this country, we've had training for instance, female and male volunteers within the community who offer to do this preparation for burial. Very often communities don't have the skills or knowledge on how to do that. And so that requires mobilization, and it requires, active preparation before the disease takes hold. And fortunately, we do have some lag time in places like Africa and Asia, in that the disease hasn't taken hold very heavily yet. And so we are urging staff to mobilize at a local level with local partners around that. And we have offered these more detailed guidelines to enable that to happen. Having said that, our advice to our staff and our partners is that don't just use these guidelines, use them in conjunction with local religious leaders and local religious authorities. Don't set up in competition to them. Have a discourse with them, find out what their guidance is, inform them, as Dr. Jaffar said, of the science. And we find Muslim scholars very responsive to science. Usually they'll accept, oh, this is a problem. OK, we've got to change. We've got to use the flexibilities in religious teaching. So that engagement with religious leaders has been something that I've urged on our field teams. And if people are interested, we can circulate the guidance on messaging to colleagues here that we've put out around this. I hope that's helpful.
Great. Dr. Jaffar, would you like to finish off that question from the WHO's perspective?
Yeah, thank you. I fully agree with that. He very eloquently summarized. Just to add that we have to keep in mind that even in a uniform faith, where here we are talking of, let's say, Muslims or Islam, every country has a different context. Countries aren't alike when it comes to practicing or implementation of what the governments or the local ulemas or the local scholars have advised or given advice to the people. there is so much diversity in it, and we have to take that into account, because the guidelines, whether those are issued by WHO or any other organization, including faith-based organization, mostly cover the broader elements. So social distancing, guidelines on burial, iftars, and prayers, and so on and so forth. But the country-specific situations guided how these are implemented. So I think this is important to keep in mind, that it's not a one-size-fits-for-all. These are, yes, broader guidelines. Yes, there are Islamic injunctions. Yes, there are faith-based prescriptive statements. Yes, there are in Muslim religion, Islam or Christianity or other religions, there are their own injunctions, but the application of it is different. Yesterday I was looking at a video. I'm sure these days we are also suffering from this issue of what we call the infodemic. It's not a pandemic only, it's an infodemic also. So all these myths, you know, the virus was grown here, and this was used as a biological weapon, and this kind of thing. But yesterday I was looking at a video from Ohio, where people were going to church on Easter, and when the health worker were asking them, you know that this is dangerous, you are gathering, and the answer was, no, I'm immune because I have Jesus' blood. So, or I'm covered with Jesus' blood. And the same the Muslim can say, the same any other. So it is very contextual. So information is out there based on expertise, whether those are science-based guidelines or those are faith-based guidelines. So they come on expertise and knowledge, but then application of those guidelines vary a lot, and they are mostly affected by the local cultural, the governance mechanism, the community cohesion, the community buy-in into those what the ulama is saying, or scholars are saying, what the government is saying. There was a specific question from Malaysia about the guidelines we have issued on 15th of April including for Ramadan, including charity. And again, here we have given, because there aren't specific SOPs included, again, these are local, it has to be applied to the local context. So what we are saying in our guidelines, that because in the month of Ramadan, there are a lot of charity going on, people gather and food is distributed, money is distributed, and so on and so forth, which we do not recommend. We recommend social distancing. So every country has a risk assessment mechanism locally done with WHO, and based on that, how to apply these guidelines. And then finally, one of the key in this pandemic is, in fact, it is much more than the case finding, detection, and treatment, and follow-up, and contact tracing, is risk communication. How effectively we collectively can do effective risk communication, that's the key to address this challenge of this pandemic we are facing at the moment. Over to you, Simona.
Great, thank you very much. It was very, very useful. I think I have one for our programmatic colleagues to talk a little bit about the COVID response. Obviously, we're all facing very, very challenging times with lockdowns and restrictions on movements. So we have a question about how we are making sure the aid is getting through to beneficiaries. We've already had great challenges with conflict areas before COVID-19, but now that this is a global pandemic, aid workers and volunteers are exposed to the virus as well as to all the various other risks. So Sabah and Noor, I was hoping that you could discuss a little bit about how we're managing to cope and how we're managing to still get aid to those in need.
Yeah, sure. So thank you for that question. Not only the staff and volunteers, but the safety and security of staff as well as the communities that we serve has been really paramount to Islamic Relief's approach in the COVID context. So in terms of reaching beneficiaries, what we're doing or what we're trying to do is ensure that any projects that we're undertaking are adapted for the COVID context, but remain effective as emergency responses. So what we're finding works really well is things like transferring bank transfers as cash assistance for people that are affected by lockdowns. They can't access food or hygiene items or anything. But in those countries, because they're on lockdown and the restrictions on social distancing and so forth are still applicable. So in contexts like Albania, Kosovo, and in Jordan, they're really restrictive, and in some cases more restrictive than we're seeing here in the UK. So how do you actually help them without harming them? And in Albania and Kosovo, for example, we've targeted 1,000 families each. Those families were already, they were on our system already. They're part of the orphan and child sponsorship program. So we've been able to transfer cash assistance to them via bank transfer. So they're able to access that, whether they want to do online orders, whether they're going to go and be able to purchase. That's all been mapped out. And so we are assured that that response is effective. In other cases and in other countries where it's not so possible to do cash, we are still adapting and adhering to whatever guidelines are in the country. So whether that's social distancing, not having gatherings, you just have to make sure that we are doing the projects, but obviously doing it in the most applicable way. And this changes on a day-by-day basis as well. So as you know, all these restrictions are changing. So we just have to be flexible and adapt as much as we can. And each of our projects undergoes kind of risks and assessments, and we have backups in place. So it's about reaching people in need as quickly as we can. And just to touch on the point about when I was talking earlier, I said the second kind of pillar of our approach is supporting existing mechanisms. So countries like Pakistan, they have really active and responsive national disaster management authorities, same in Tunisia as well. So rather than us work in isolation, we're really coordinating as much as we can with authorities like that, with local actors, and then we're supporting initiatives and supporting existing health facilities. So again, when it's done in a coordinated manner like that, we're able to really ensure that we're doing no harm and having an effective response as much as we can. So I hope that answers the question.
Sister Noor, I believe you're on mute.
To add to Sabah, in the countries in the Sahel where we are currently doing our programming, we have not suspended all activities. Where there are activities in relation to emergency intervention, it is still ongoing, but we have outlined detailed protocols to staff and also communicate that clearly to our partners, the authorities, and to the beneficiaries in how we will implement those objectives, starting from how the staff will travel out to the site and how the communities will congregate in delivering our activities. And just to add to that, recently Islamic Relief Mali and Niger, we received containers, 2 shipments in each country respectively of pharmaceutical and medical items. And this has coincided with the COVID and has become useful for the Ministry of Health in both countries. And with that, they are able to strengthen the health systems too. So we have taken different measures and are very flexible in ensuring that whilst we observe the restrictions, but we continue to deliver our mandate, our humanitarian mandate.
Great, thank you so much. I think this brings us to our last question from our colleague Zulik Fikar, forgive me if I mispronounce that, from Wealth, Hunger and Life in Pakistan. And he's got a two-part question, which I think is probably best for Atala and Dr. Jaffar. But he basically says religious leaders, the capacity of religious leaders is often a challenge. So how do you reduce the risk of them misunderstanding that or misrepresenting those while implementing the guidelines that we have designed and also the ones by the WHO? And then the second part of his question is, again, coming in the Pakistan context, obviously, yes, the government has introduced standard operating procedures there. They have guidelines, very strong guidelines. But when it comes to the day-to-day, imams don't have masks. They might not have hand sanitizers. They might not have the ability to actually implement those masks and to implement those guidelines that we're seeking them to do. So how can we change the behavior of communities when they're kind of facing that duality?
Thank you. Yeah, I believe this is a real challenge, and we do hear from some of our offices. I was speaking to our partners in Nigeria as well that was saying that there's massive challenges around faith literacy, detailed faith understanding within some of the imams in some areas. And obviously, these are fairly complex issues that require the combination, as Dr. Jaffar said, of science and religious jurisprudence. They won't be qualified on their own to make those sort of decisions. So they need to be empowered by their seniors around this. So our advice is kind of counterintuitive in many ways to the way we normally work, is to actually start from top down, engage with religious leadership at a national level and at a regional level, and work that down, because religious leaders tend to respect highly the views of their colleagues, their senior colleagues. And particularly if they've, for instance, been studied at a particular university, if those academics and scholars at that university issue edicts around that, they'll take more notice of that. So in our guidelines, we've sort of highlighted a couple of fatwa or religious edicts that have taken place on collective worship. There's been numerous local ones, and obviously they're more powerful if they're local, because everything is to do with the context in Islam. So this issue about use of PPE, etc., will all be down to the local context. And in the burial guidelines, we stress that that actually washing could take place still with water if there are those facilities for the body washers to have the right protective gear. And if they don't have it, they can do an alternative, or none at all even. And similarly with mass graves and all of these things, and all these allowances, but they're complex, and the problem with religion generally is a little bit of knowledge is dangerous. So it is very important to work from top down, to take the community with you as a whole, rather than just trying to convince imams at a local level. Thanks.
Thank you. I cannot add much to what very eloquently Atalla said. I just a couple of experience we have in the region, Pakistan, where my brother Zulfikar posed a question, is one of the country where it's a big country, and there is always a big divide when it comes to religious groups, or fiqhas, what we call them. And then we work with the highest level of the political leadership. So those scholars were invited by the President of Pakistan and the Prime Minister of Pakistan to get a buy-in and have a uniform policy. So engagement from the political leadership with the religious leaders is extremely important. And as I said, and Allah reaffirmed it, it's very contextual. It's a complex issue, but it's very contextual also, and it depends on so many variables. Finally, PPE alone, according to WHO guideline, is not the panacea for all ills. It cannot prevent if you have a mask or even if you put on gloves. You have to follow all the public health measures: hand washing, personal hygiene, social distancing, knowing the contact, knowing the positive case, isolating the positive case, treatment, infection control, follow-up. So this is a package, and picking up on one or two of them wouldn't help that much. So our recommendations always to the communities, to the decision makers, to the head of states, to the ministers of health is, please, I mean, today we had a meeting with all the 22 ministers of health from our region, and the Director General was linked there also. And his last plea was observe all public health measures. And he referred especially to Ramadan, and he said, please make sure that the decision makers work with the religious scholars and the religious people to make sure that all public health measures are, because alone one mask or PPE will not suffice to prevent or help in containment of the outbreak. Thank you, Simone. Over to you.
Great. Well, thank you so much. I'm afraid that's all we have time for today, but I do want to leave you with a note from Sheikh Fahim from the British Board of Scholars and Imams. He sends his apologies. He tried very, very hard, but technology did fail him. However, he wants you all to know that the BBSI has published a detailed guidance on stopping the virus from a religious perspective and issued justifications on preventative measures, mosque closures, burial matters, and yesterday also published the guidance on Ramadan, which has detailed issues on things like fasting, which we have already discussed. They're in the process of disseminating that with communities, and we look forward to working with them in the future to making sure guidelines like these are developed and disseminated to where they need to go. He urges you all to visit his website on www.bbsi.org.uk, and of course, please do feel free to email organisers with any questions, and we'll try and get that answered to you. So with that, without further ado, I'd like to say thank you to all of our speakers. We were supposed to have a 1-minute roundup for everyone, but I think we've run out of time. So thank you everyone for joining. We really appreciate your time, and we wish you a happy rest of week. And for those of you celebrating, Ramadan Mubarak.
Thank you so much.